All right, so we're going to go ahead and move into the 8th and final module. So this is the fun stuff, implementing and sustaining your program. Okay, so acknowledgement and disclaimer, just so you guys know. And moving on to Module 8. So from scheduling considerations to program operations, this module will take us through the activities and decisions needed to effectively implement your Worksite Health program. These are your learning objectives. Leverage your health promotion committee, so going back to that, the importance of your committee. Implement a master schedule. Initiate operational approaches to manage and sustain your program, and then manage the evaluation process. Access technical assistance to support development of your Worksite Health program. So the peer learning activity, you will use the program design worksheet to plan a little P program or health promotion activity event. So we went ahead and we talked about how to establish that, the health promotion committee, and how it's important to have an array of different employees from all different sectors of your organization on that committee, and now we're going to put them to work. So, clear operating guidelines are crucial to the success of the committee. First meetings should provide an overview and orientation for members and include a member commitment pledge. In the first pass of developing a master schedule, put only the event name or a short title description in the appropriate month, but categorize it by program intensity level. By building a master schedule that is categorized by intensity and type of activity, you will be able to quickly decide if you have too many nutrition challenges planned and not enough movement. So this talks about, again, planning for optimal performance, and it talks about how the health promotion committee can have a master schedule and what that looks like. And we just wrote a really great SMART goal, and I think that pertaining that to this schedule is very realistic. So consider using a responsibilities and timelines matrix, which is shown here. Let's see here real quick. Right here we go. To make assignments and put program start dates and end dates together. The matrix should include program name, program intensity level, the overarching goal that is supported by this program, program purpose, program start and end dates, and who has overall responsibility. And I think this nicely shows the importance of identifying who's responsible, but then obviously our supported goal. So a health program design worksheet. This section introduces and explains the program design worksheet to help plan and design your little P programs. Use a program design worksheet to plan and then propose the little P programs. If buying a program from a vendor, use the same questions to ensure you understand what you are buying. So, the program design worksheet has 3 segments: proposal, plan, and timeline. Proposal. The Worksite Health Program proposal process provides, let's see here, name, purpose, provides an opportunity for input on program plans, which means you get more ideas, solutions, and better programs. So this is an example of a proposal worksheet. There are 4 timelines that need to be either planned or discussed with the vendor: program preparation time, marketing, delivery time, and evaluation time. These are all very important in regards to your overall worksite health program design. So for instance, Sue, you're doing the October breast cancer awareness. So you could almost duplicate this with what your potential proposal is, correct?
Yes.
And I think one of the nice pieces of it is way at the bottom, what we tend to forget to do is evaluation, correct? And do we have an evaluation piece for October for your program?
We do. We do.
Okay.
So part of it is, so it's an awareness activity. So the number of employees we touch, and then we call them units of participation. So
Great.
I might get one person who participates in every event, but then we'd also, so we'd look at total units of participation, but then we would also look at unduplicated numbers.
Okay.
So the two different evaluations. And then when we have, we'll have the speaker come in, there'll be a survey that we administer at the end of the survey. And then what we'll do is,
Satisfaction.
yeah, you know, were they knowledgeable? Did they learn something? Would they want to learn more about this topic? Is there something else they'd want to learn more about, which will help us, brings us right into plan for the next activity? And then what we can do is grab the names of everyone who participated. They can get an email to do a survey just in general. Why did you participate in this event? What did we do that was good? What did we do? What would you like to
Change.
learn more about? So then,
That's
again,
great.
that then is the feeder system for the next activity.
And feel free to use this proposal because I think it might help you in furthering, you know, all of your health and wellness goals. So this goes to the second P, which is plan. And so after, so plan is obviously, you want to have a description, the roles, requirements, registration, orientation, all the logistical pieces that are important with designing the worksheet. And then, excuse me, social support, environmental support, tracking systems, forms, incentives, celebration. So putting that plan into motion. Timelines, very important. So you have to have a timeline for how long your preparation is going to take, marketing, delivery, and evaluation. So you may put a timeline for evaluation for 24 to 48 hours to get those evals back, especially if they're electronic. You could do a survey monkey of your worksite health program, and then you want to be able to get those back in a timely manner. Okay, so these are program scopes and mix as far as different models. You have health assessment, biometric screening, awareness, lifestyle, and environmental. What you want to do is make sure that each of these, if you decide to implement each of these, that they all are measurable, but then also who is going to be focusing on each item. So keep that in mind when planning. And I think staffing it, you know, for smaller businesses, you may not have enough staff to put at each item, so remind yourself that you may want to eliminate some, or remind yourself that you're limited if you're a smaller business. So don't feel overwhelmed. And I know your site, again, Carolyn, has 80 employees. Is that what you said?
About 97.
97, okay. So keep that in mind as far as who you're going to address there. So this is our calendar. After the little p programs have been finalized, the confirmed start and end dates can be put on the master schedule. And a big calendar with strategic dates can be developed for committee members. So teams now can develop 2 program calendars, a big calendar and a monthly program calendar. All right, so as you can see here, it spans across an entire year. Don't let that overwhelm you. I think it's safe to say that planning is important, but to keep that realistic, a year is looking out a year and what would be attainable. I think 6 months is also something to plan for as well. As far as sharing and continuing our health promotion committee work, let's look at the next one. All right. So you have your event, you have your health promotion committee, you've given out responsibilities, you're able to staff that event, and then you have a calendar around that event. And to be able to have this in writing is so much more helpful. Let's see here. So we have the kickoff date. So, moving on, this topic discusses program launch, including phased versus full program rollouts. Other subtopics include hard-to-reach populations, which we were talking about earlier, such as shift workers and implementing a family program. Program launch or kickoff only happens once in the life of a program and is an opportunity to create a positive energy that engages employees around health, work-life issues. Okay. So some items that can help with this kickoff, as you can see here, is a letter of support from your CEO or your president, health fair screenings, health promotions, motivational events. So these are 9 principles for launch success. You want to test it, listen, and use feedback, determine needs and interests, use easy health concepts, stay positive, obviously, first impressions, do it with style, use participation, satisfaction measures, and don't launch until you are really ready. Now we're going to look at items to consider prior to rolling out your program. So management team vision, commitment, urgency, opportunity, etc. And some of these items, depending on the size of your business, you may not be using. Do any of these jump out to anybody as far as worksite wellness items that they've already rolled out, or if they're currently going to roll out that they've used, as far as like the management team, getting them involved, getting their vision, that type of thing?
So we'll go back to that same idea, that Breast Cancer Awareness Month thing. The announcement came from the CEO. Mm-hmm. And we're starting with October 1st and just doing a themed dress in pink day. Okay. And we're a very traditional organization, so everyone dresses up every day. So we learned long ago that dress down tickets are very valuable. So everybody who shows up wearing pink is going to get a ticket for a dress down day that they can use over the next 90 days. But they'll get their dress down ticket stapled to a breast cancer fact sheet.
Okay.
So we've got the hook of what we know people want, mm-hmm. and so we use that to then do that teachable moment kind of
Great.
A thing. But it all starts with an announcement from the CEO that says, I'm wearing pink, please join me. I want as many of you here that day as possible. Here's what I'm going to give you.
Absolutely. Well, that's a great roll-up. Great. So, program startup in multiple locations can be both an organizational and logistics challenge. Unless you really have the support and resources to pull this off, you'd be better off using a phased-in approach. So the phased-in approach, let's see what we have here. Service capacity, costs, ownership, and quality. So There are subpopulations within many work sites that are either non-compliant to core program offerings and/or are faced with unique barriers to engagement. There are strategies for reaching these difficult subpopulations. So addressing those hard-to-reach populations, here we go. So we talked about this because some of our work sites have multiple locations, correct? And I think the other piece of it too are shift workers. So addressing hard-to-reach populations, you have a lower educational level, lower income. So participatory incentives versus disincentives for engagement. Participatory is specific to basic participation. There's no incentive. It's just you voluntarily participating in the program versus getting an incentive to be engaged. Males are typically resistant to having a primary care provider or following recommended preventative screenings and immunizations. They're also resistant to participating in health assessments and/or biometric screenings and complying with physical activity, healthy eating, tobacco, and alcohol recommendations. So we talked about that, that phone call as a form of means of communication, and then calling that spouse and getting that checkup, right? And I think that that's important to note here in as far as the hard-to-reach populations for some of your work sites. So just to remind ourselves that health literacy, language and cultural barriers, and mistrust are also barriers to engagement and make some subpopulations hard to reach. When it comes to family health decisions, engaging the female of the household is a solid strategy, for she is traditionally the primary decision maker and caregiver when it comes to family health. Shift workers, time and access barriers to programming. Professional staff not available during shift hours or off-shift time conflicts. So you want to be able to offer these programs during off-shift hours. We like to call them the night owls, right? Specifically for corporate, or blue-collar workers that are working a 3 to 11 or 11 to 7. So we want to make sure that we address that population. This is just continued. We talked about the health literacy earlier and communicating our health education in plain language, not using big words around health literacy, and then obviously being very sensitive to the cultural barriers. Again, building the trust around management and middle management when implementing your worksite wellness promotions. You want to definitely build that trust in order to offer engagement. All right. So, slide 22 lists tips to consider when deciding whether to implement a family program. Oops. So families represent a significant portion of healthcare costs, correct? And health can help restore much needed balance into families, and families have a significant impact on each other's health. We talked about the woman as the primary caregiver, and we talked about her being the gatekeeper as far as getting people to go to the doctor or for their checkups. And I think the policy around the reducing the sugar-free beverages is important. Then promotion, what is the communication and persuasion strategy mix? I think utilizing the televisions in your break room, lunchroom would be a good communication tool.
Angie, I think price too, you have to even think about what are people willing to invest in terms of their time. Is this something that you're going to get a ton of people to come to if it's during the workday and they're going to get paid? Or your shift workers, are they willing to come in a half an hour early or stay a half an hour later? Are they willing to give up their free time? Because that's really part of price too. What's it going to cost them?
That's great. I like where you're going with that. That's a really good point. And are incentives going to be used? Well, it depends on our budget, right, guys? Mm-hmm. And if you are able to offer incentives such as paid time off, that's always a really good opportunity to use that. So it all depends on our budget and our leadership support with that. Okay. This is for vendors, communicate expectations. Here we go, implementing it. All right. So participatory worksite health programs are defined as programs available to all similarly situated individuals that either do not provide a reward, which is what I was just explaining, or do not include any conditions for obtaining a reward based on an individual satisfying a standard that is related to a health factor. So participatory is basically the person is voluntarily doing the wellness program. So if you remember through UMass Lowell, they were doing a participatory program for their worksite wellness piece, and that's all online to access. And that does not provide a reward. So that's the difference between the other one, which is the health contingent worksite health program. Health contingent programs require an individual to satisfy a standard related to a health factor to obtain a reward. Does anybody want to give me an example of a health contingent worksite health program? We talked about a couple of them. And that could be weight loss,
Reduce your BMI.
reduce your BMI.
Get your physical.
Absolutely.
Quit smoking.
Quit smoking, that's right. So they're also divided into two subcategories. It's important to note, activity-based and outcome-based. Let's move right along here. Okay. And just briefly, health contingent programs require an individual, like I had said, to satisfy a standard related to a health factor to obtain a reward. I just wanted to clarify that. All right. So let's go ahead and move to slide 27. Here we go. So leadership support. This section provides an overview of program operations, revisits data collection and analysis, and lists common implementation pitfalls. Program operations staff is concerned with overseeing and controlling the day-to-day processes involved in a worksite health program. This slide lists the major areas that take almost daily management. So it kind of takes an army to operate as far as the worksite health promotions. So you have leadership support, policy, environmental interventions, incentives and disincentives, project and vendor management, and then communications and marketing plan, along with risk management and legal issues. All right. Okay. Policies and procedures, manuals document administrative actions from program planning and member orientation to recognition and incentives. These are living documents. Effective programs systemically evaluate their implementation and operation actions with the aim of using the findings to improve and maintain management support. So, data collection and outcomes management.